Heartburn is a condition, in medical terms it is called gastroesophageal reflux. So our stomach is made to sustain the acid which is produced inside the stomach. But when this acid comes up in the food pipe or the esophagus, it causes burning sensation because our food pipe is not meant to tolerate these kind of acids. This acidic reflux in the food pipe causes heartburn. It's a basic burning feeling in the middle of your chest behind your breastbone, which is generally associated with the food or with the posture like bending forward or lying down. It is confused with heart attack because heart attack also has symptoms of chest heaviness, and if there is a heartburn, people feel that it can be a heart attack. So heart attack is a condition when there is decrease or complete loss of blood supply to the certain part of heart. This causes a severe chest pain in the center of chest, but it is not localized. So what you will feel is like a heaviness in your chest, or there is a heavy weight on your chest, and this is very uncomfortable with a lot of sweating, perspiration, cold sweat, breathing difficulty, uneasiness, sometimes unconsciousness, and this chest heaviness radiates toward the shoulders. The chest heaviness can happen, like in heart attack, the pain can happen from lower jaw up to umbilicus. But in heartburn, generally it is behind the breastbone and it's generally localized. So anginal chest pain is because of decrease in blood supply to the heart when heart is needing more blood supply. Like if you start walking at rest, heart needs less blood supply, and during exercise, heart needs more blood supply. So if there is a blockage in coronary arteries, maybe 70, 80 or 90%, then during exercise, heart will not get enough blood. So during exercise, you will feel chest heaviness, uneasiness, chest pain radiating to the left shoulder or left arm, and this generally relieves by rest. This is called classical angina. Heartburn is mainly acid reflux in the food pipe. So heartburn pain generally increases starts from the upper abdomen and radiates up centrally up to the neck or even up to the throat. In heart attack, pain is generally in the center of chest, sometimes more toward the left. It radiates toward the left shoulder or back between the collarbones, or sometimes to the left hand also. Indigestion is basically again when you are eating too much or your stomach is full and your gastric emptying is delayed because of excess food in the abdomen. There is some reflux in the esophagus, and this reflux is along with the acid which is formed in stomach. So this causes heartburn. And other conditions, like if there is decreased motility of the stomach, that can also cause problem. If there is too much gaseous distension of the abdomen, this can also cause heartburn. To avoid a heartburn, definitely we have to make sure that our esophageal sphincter, which is dividing between stomach and esophagus, should be working. So this generally is not in our control, but if we avoid too much of spicy or oily food, and if we avoid overeating, and if we go for some walk after eating and not going for immediate sleep or something, then we can avoid heartburn. Sometimes if it is not possible, we have to take help of some physician or a stomach specialist. Any condition of chest pain, if it is associated with sweating, perspiration, uneasiness, feeling of impending doom, or radiating toward the hand or shoulder, it is generally an indication that we should take some consult. If it is just a single heartburn, a localized pain behind your breastbone, and is very occasional once in a while and relieved, it may not be urgent, but if it is happening repeatedly, for that also we have to have a cardiac consult. So sometimes many patients, especially diabetic patients, they get confused between cardiac arrest or heart attack and heartburn. So it's always better to have a emergency consult when you are feeling chest pain which is lasting for more than few minutes.